Thank you, Jane. That was a little bit scary, but I'm glad we indulged you to the end so that we could find out at least something we can do about that. Now, tonight our second speaker is George Crisp. George completed his medical and general practice training in London before immigrating to Perth in 1993. Working for a wide variety of urban and rural settings, not for, he has become increasingly aware of the importance of social and environmental factors that determine our health and well-being. It is this interest that has led to his involvement in Doctors for the Environment Australia, where he is the current WA Chair and National Committee Representative. With a like-minded colleague, he has developed Green Practice, a model for greening general practice and highlighting the health co-benefits that can be gained by environmental actions. Outside of his medicine and family life, George is a keen footballer, as in soccer, and he plays keyboards in a rock band. So, welcome, George.
Thanks for the opportunity to talk. I'm going to tell you a little bit about Doctors for the Environment and also talk a little bit about Green Practice as well. Doctors for the Environment is a national voluntary group of doctors, and our interest really is in the relationship between human health and the environment, and environmental degradation and how that affects our health. And many of the things that we do in terms of our activities and industries end up causing environmental damage, and that nearly always comes back in some form or other to affect our health. And so the doctors that are involved in this area of interest is really with an expertise is in this area, and we are involved in sort of both educating the public and talking to other doctors, talking to politicians, and also in sort of writing submissions and other sort of material for medical magazines, etc. So we have an interest in quite a few issues at the moment, which include things like sort of climate change, which has a very significant sort of impacts or potential impacts on our health in the future, on energy in terms of coal seam gas, as mentioned, and you may also know that fracking has started to occur in Western Australia now in the shale. At the Perth Basin, and we're sort of being involved in that. One of the things that we are running a campaign on at the moment is regarding sort of sustainable healthcare. Healthcare really isn't very sustainable, and although we've got quite a good idea about the sort of economic parameters of health services and the social aspects, we haven't really started looking very much at the environmental limitations. So we could learn quite a bit from the sustainable movement in this regard. And so with regard to health services, healthcare is really a major consumer of fossil fuel energy, and also a greenhouse contributor in other ways as well. Through procurement and buildings, etc., produces a significant amount of waste and pollution. If you look at the carbon footprint of health services, the UK NHS is responsible for 3.2% of UK's total emissions. We don't have data for Australia, but it's likely to be significant. Victoria has done some work on public hospitals, and they use 60% of public sector energy. So climate change is considered to be the biggest threat to global health, and we're already seeing health impacts. WHO expects that about 160,000 people globally are now dying as a consequence of climate change, and we're seeing the impacts already in Australia, in terms of increased heat-related deaths and mental health issues related to climate change. There's another good reason, of course, to improve sustainability in healthcare, and that is really the co-benefits of acting. You know, there are lots of other sort of advantages or sort of things that happen when a lot of the things that we do actually have other sort of benefits for our health, which I'll mention. It's interesting that the AMA, which is Australia's peak medical body, actually does have a policy on climate change and human health. And in their policy, basically, they state that they support policies and practices compatible with a healthy and sustainable future, and they encourage the sustainable reduction of carbon emissions from healthcare facilities and organisations, and act as role models for others reducing emissions in their own practices. So we really need to help remind them that this is their policy, because they don't always do a lot to promote it. So if any of you do have doctors in your family, or that you know, you should ask them about asking their association to do what they're sort of suggesting. In the UK, however, they have made moves in this regard, and there is a Sustainable Development Unit now which is aiming to guide the NHS to reduce its emissions really very considerably, and that's through a number of mechanisms, through energy for buildings in terms of trying to source lower emissions energy with cogeneration, etc. Also with procurement, because procurement actually is the biggest slice of greenhouse emissions in health services around the world. Waste and recycling and reuse. There's unfortunately been a continuing move to disposable surgical equipment, which adds an unnecessary sort of waste stream, and through staff and patient travel. And if you look at the UK now, they're encouraging people to use active transport to get to work or to visit hospitals. And of course, there are co-benefits, as I was mentioning earlier, in terms of increasing the amount of activity we do. Also helps, helps our health in other ways. So I'll move on to green practice, which is the other bit that I was going to talk about. And green practice is another initiative that we're promoting through Doctors for the Environment. I set this up with another GP in Perth who I work with. And whilst there are initiatives that are happening internationally in the sort of health service or the hospitals, there's not been very much happening at the sort of general practice level. So the idea really was to provide a model for general practitioners to follow, or to use, and materials to use that would help them to sort of green their practice and promote the benefits. So this is a certificate that we produced, and this can be downloaded and printed and put in the waiting room, just to tell patients what we're doing, and then they can sort of ask why we're doing it, and also, as I mentioned, a lot of the things that we're advising people to do for their individual health are actually also good for environmental health as well. So, encouraging active transport, trying to reduce energy use, particularly in terms of food, foods that are highly processed or overconsumption. So, and this is another promotional material that we've produced for doctors' waiting rooms, and again, it details some of the things that people can do to achieve both of those aims, in terms of both promoting individual health and environmental health. Green Practice, that's the Green Practice card and logo, and it was actually a project that we did in conjunction with Central TAFE, and the final year art students did all of the graphic work for this as part of the final year project, which is a very interesting exercise. I don't know if I've got very many other things to say about Green Practice. We've, in terms of co-benefits, you can look at it as at several levels in terms of benefits on an individual basis, benefits that are community benefits, and of course the wider benefits in terms of climate change and other sort of issues of waste and pollution. And the object of sort of trying to improve sustainability in health services is also achieved through these other aims as well. So I rushed through to get through in 10 minutes, a bit too quickly. So thanks very much.